Hello physios, I welcome you all to our channel Physio Vidyapit. We are back with our next lecture on shoulder complex biomechanics. So this is lecture number 3 under the shoulder complex biomechanics, where we are going to start the acromioclavicular joint. Okay, so in our first lecture we studied that there are sternoclavicular, acromioclavicular and glenohumeral joint. Okay, and also there was a scapulothoracic joint, which was not a anatomical joint but a functional joint. So you can see that this one is scapula. Okay, this one is a scapula and this one is clavicle. Okay, so the acromioclavicular joint is the joint between acromion process. This one is the acromion process of scapula and the lateral end of clavicle So what will you write? You will write that acromioclavicular joint is a joint in which articulation occur between acromion of scapula bone and lateral end of the clavicle. This is like this. Okay, so the bones are like left sided person bone. Okay, so let me see. Okay, so from clavicle it is lateral end. Very good. And from scapula it is the acromion process. And from acromion process I will explain that not the whole acromion but a small portion of it, which is called the facet, is taking part in articulation. Okay, so this is not, we can say, like much a stronger joint, and it is also an incongruent type of joint. And here also we will be having a proper sub points as we discussed in the sternoclavicular joint. So now first of all we will focus on the type of joint. Type, I will write it as plain synovial joint. Okay, but in some persons there will be variation, or the surface can be mildly saddle, that is reciprocally concave and convex. Okay, so here in biomechanic discussion we will refer this joint as a plain synovial joint, and also it can be a saddle joint where the surfaces can be reciprocally concave and convex. But you will see that this point is similar to the previous joint, that is the sternoclavicular joint. There also we regarded it as a plain synovial joint. Also we said that the surface can be saddle, that is reciprocally concave and convex. Now degree of freedom. Remember one thing, whenever the joint is plain synovial joint there will be triaxial. Okay, there will be triaxial motion. So the degree of freedom is 3, which is also 3 translatory and 3 rotatory movement, which we will discuss further. Okay, so till now what we have studied that what is acromioclavicular joint, what type of joint it is, and what is the degree of freedom. This type and degree of freedom is same as in the sternoclavicular joint. So I will write here SM so that you can revise from your notes very easily. Okay, same. Okay, degree of freedom is same, but I will discuss movement that and the name of the movement is definitely somewhat different. Next is the articular surface. You will say that, sir, the lateral end of clavicle is articulating with the acromion process of the scapula. Yes, but not the whole acromion. You can see this is the acromion. It is like a big part of the scapula bone, but only a small portion of it, that is the facet. Okay, acromion facet is taking part in the joint formation. So articular surface are like articular facet of acromion. Okay, and lateral end of clavicle. Lateral end of clavicle. Okay, so from visualization also you can see that it is a very incongruent type of joint. Very incongruent type of joint. Okay, was the sternoclavicular joint an incongruent joint? Yes, it was also an incongruent joint. So I will write SM here also. Okay, so this is like you can tally the two joints and remember them very easily. Okay, so the sternoclavicular was also regarded as plain synovial. Also, we said that it can be either reciprocally concave convex or convex concave, and degree of freedom is also same with the sternoclavicular joint. Articular surface are different, but that was also incongruent and this is also incongruent. And in the sternoclavicular joint where the articular surface was incongruent, was there any special structure? Yes, it was a disc. But before studying about acromioclavicular joint disc, let me explain you one another important thing of the articular surface. It is that the articular surfaces are vertically oriented. This bone is the clavicle bone, which is the horizontal bone. That is, it is placed horizontally in our skeleton and this articulate with the acromion. So the orientation of the articular surface is vertical, which is very important. So it have a vertical orientation. Okay, vertical orientation of articular surface, and this orientation can vary from individual to another individual from between 16 to 36 degree. Okay, so if this is the vertical axis, there the variation is between 16 to 36 degree. Okay, either this one or this one. That is, if the articular surface are like this, either it can be slight like here, okay, in this part, that is 16 degree, or here 36 degree. Okay, so the orientation is labeled as the vertical orientation of the articular surface. And also, is there any variation? Yes, definitely there can be some variation, that is 16 to 36 degree. Now we are moving toward the acromioclavicular joint disc. Okay, so in the sternoclavicular joint, the disc was very important. Okay, and here the disc is not much important. Okay, so here the disc is like present between the articular surface and definitely may increase some congruency. Okay, improve the congruency, and it is not much stronger. But one thing that you need to remember is that below 2 year, okay, so when the age is less than 2 year, this disc is fibrocartilaginous in nature, and after 2 year it become a meniscoid. Okay, it become a meniscoid. Okay, so this was whole about the the acromioclavicular joint disc. Now moving toward the capsule and ligament. Okay, capsule and ligament. So here is also a disc, and in sternoclavicular joint also there was a disc. So same point is repeated. But the thing is that this one is weak and also not much important, but that was very important. Okay, so till now, what is acromioclavicular joint? Articulation between lateral end of clavicle and the acromion facet, okay, of the scapula bone. Type plain synovial joint, similar to sternoclavicular. Can be settled? Yes, same as the sternoclavicular joint. Degree of freedom is triaxial, that is 3, same as the sternoclavicular joint. Articular surface are incongruent, same as the sternoclavicular joint. But the thing is that here the articulation is vertical, that is surfaces are vertical and can vary from 16 to 36 degree, which is a difference. And disc also, disc is present, which is a similarity, but here the disc do not gain much importance because like it is not that strong. Okay, and important thing is that less than 2 years it is a fibrocartilaginous disc, and after that it become a meniscoid. Next is the capsule and ligament. Okay, so capsule also, it is a weak capsule which is reinforced by the ligaments, and ligaments are one of the most important part of acromioclavicular joint, and you can expect a 3-mark question from the two ligament. Okay, so first is the acromioclavicular ligament. The naming is same. It is present between the acromion and clavicle. So this is acromion, this is clavicle. This one is lateral side, this one is medial side. So it will definitely connect the acromion and clavicle. So this one is superior acromioclavicular ligament, and this one is inferior acromioclavicular ligament. Okay, this I am drawing just to make you understand. Okay, you can see the real diagrams from book. Just to make you understand, one is present at superior and one is present at the inferior part. Okay, in the sternoclavicular joint, was there a sternoclavicular ligament? Yes, definitely, but it was an anterior and posterior sternoclavicular ligament, but here it is superior and inferior acromioclavicular ligament. Okay, and what are its function? First function is that it help to hold the articular surface. Okay, hold the articular surface toward it, so it will push the acromion and clavicular toward it to maintain it together. Also it prevent, second function is that it prevent anterior translation. Okay, it prevent anterior translation which is caused by any sort of superior directing force. Okay, so this is the acromioclavicular joint, and if there is any superiorly directing force and if there is vulnerability to cause an anterior translation, it will definitely protect. Okay, superior and inferior acromioclavicular ligament do not resist superior and inferior translation but restrict the anterior translation. So definitely this function is very important. And next function, or we can say important part of it, is that superior one is much stronger than the inferior one. Why? Because you know that here are two beautiful muscles. One is deltoid at this side, and from here upper trapezius are taking, we can say, having their attachment, so which will reinforce the superior acromioclavicular ligament. So superior part is more stronger than the inferior part. Next is the coracoclavicular ligament. Okay, so coracoclavicular ligament, this is the acromioclavicular joint, and this part is the coracoid process. It is not a structural part of the acromioclavicular joint, but it helps to connect the coracoid process to the clavicle. Okay, so it have a very important function that I will explain you within few minutes. So this ligament will be moving from the coracoid process of the scapula to the lateral end of clavicle. Okay, also it have two fibers. It have two fibers. First one is conoid, second one is trapezoid. Conoid is like cone shape. Trapezoid is like this shape. Okay, it is like this shape. So here I will draw it for you. Let me take another marker for you. See, conoid part is like this, and trapezoid part is like this. Okay, like this. Beautiful. Okay, so now what you can see, that conoid part is conical, trapezoid part is like this. Okay, now this trapezoid part is bit lateral. Okay, because it is toward outward. Okay, so lateral side, and this conoid part is toward medial, so it is a medial part of the coracoclavicular ligament. Also, there must be some important function of these parts. This conoid part or the medial part help to prevent or resist the inferior translation. Okay, inferior translation of the clavicle. Okay, it helps to prevent the inferior translation of the clavicle, and this lateral part, that is the trapezoid part, help to prevent the posterior translation of clavicle, help to prevent or resist the posterior translation, not prevent, it is the resist. Okay, because some degree is permissible but not much. Okay, so this one will, conoid part will definitely prevent the inferior translation, resist the inferior translation. Okay, inferior translation, while the trapezoid part will help to resist the posterior translation of the clavicle. Also, so these are the individual function of conoid part and trapezoid part, and one combined function is that it helps to restrict the upward rotation of the scapula. Okay, so this one is the upward rotation. It also helps to resist the upward rotation of the scapula. So what are the three functions? Individual function of conoid part is resistance to inferior translation, or resist the inferior translation, and individual function of trapezoid part is resisting the posterior translation, and combined function is resisting the upward rotation, of the scapula. Another important function that I want you to explain, that whenever we are pushing something, okay, so if I am pushing my board like this, okay, I will do here. Okay, if I am pushing this wall, the force is transmitted from my hand to my glenohumeral joint. Yes. Also, some force will be transmitted to acromioclavicular joint. Yes. But acromioclavicular joint is a incongruent joint. It may undergo any sort of dislocation or subluxation. So this ligament will help to transfer the force to the clavicle so that it move toward the sternoclavicular joint, and it help to dissipate the medially directed force. So when I am pushing this wall, the force is transmitted from my arm to glenohumeral joint. Also moving through the acromioclavicular joint, it is transmitted to the clavicle. Okay, and from here, if I will extend the clavicle, here will be the sternum. Okay, so it will transmit the force to the sternoclavicular joint. Okay, so force dissipation. Okay, force dissipation is another important function of the acromioclavicular joint. Okay, so till now what we have studied? We have studied what is acromioclavicular joint, and a similarity of type of joint, similarity of degree of freedom, similarity of articular surface. But remember, it is a vertically oriented joint. Next, acromioclavicular disc, it is also similarity, but it is weak, and after 2 years it become meniscoid. Capsule is present, but it is a weak capsule reinforced by ligament. What are the two ligaments? Acromioclavicular, they are superior and inferior, and the sternoclavicular was anterior and posterior. This superior and inferior part of the acromioclavicular ligament have no relation with superior and inferior translation, but prevent the anterior translation caused by superior directed force. Also help to hold the articular surface, and superior part is strong, which you will understand due to deltoid and upper trapezius aponeuroses and attachment. Okay, last one is the coracoclavicular ligament, the ligament between coracoid process of the scapula and clavicle. Okay, and it is having two parts, conoid part which is medial, trapezoid part which is lateral. Okay, which is lateral, and the medial part help to prevent the inferior translation or resist the inferior translation, and the lateral or the trapezoid part prevent or resist the posterior translation, and both of them restrict the upward rotation, also help in force dissipation. Okay, so this is whole about the acromioclavicular joint. Now we will study about the motion and about the degree of freedom of acromioclavicular joint. The degree of freedom, as we discussed earlier, is 3. So we can write it as 3 rotatory movement and 3 translatory. This translatory can be superior and inferior translation, medial and lateral translation, anterior and posterior translation. I can draw it for you. This one is acromion, this one is clavicle. It can be lateral and medial translation. It can be superior and inferior translation. Also it can be posterior and anterior translation. Okay, but important are these 3 rotatory motions, which are named as internal and external rotation, anterior tipping and posterior tipping movement, and the last one is upward rotation and the downward rotation of the acromioclavicular joint. Another important thing that you need to understand is that these motions do not occur in pure axis and pure plane. That is, it do not occur in the cardinal axis and cardinal plane. Do not occur in the cardinal plane, but it occur in the oblique axis or oblique plane. Now you will have a question that why the motion is oblique. It is because the resting position of the scapula is not in perfect alignment. If this is my scapula, so it must be in this plane, okay, that is the frontal plane or coronal plane, but it is deviated from the frontal or the coronal plane by 30 to 35 degree. So if this is the frontal or coronal plane, this one is my scapula of left side, this one is of right side. Okay, so it is aligned like this. Okay, aligned like this. So this angle is about 30 to 35 degree, which is called scapular plane. Okay, which is called scapular plane or the scaption plane. Okay, which is the resting position of scapula, and due to this oblique resting position of the scapula, the motion occur at the oblique axis and thereby in the oblique plane. So if somebody asks you that what is the reason behind the oblique motion of the acromioclavicular joint, you will answer that it is due to the oblique placement, that is the resting position of scapula. Okay, so now we will move further toward the motion. So the first motion is internal rotation and external rotation. So shoulder internal and shoulder external rotation. Acromioclavicular internal and acromioclavicular external rotation. So definitely it is internal and this is external rotation. And let me make you understand, this is the only movement which is occurring in pure cardinal plane. Pure cardinal plane. So here axis and plane. Okay, so first of all I will write plane. It occur in the transverse plane or the horizontal plane. So definitely the axis will be the vertical axis, not an oblique vertical or the horizontal. Vertical axis and horizontal plane, they are not oblique, they are perfect and pure vertical axis and perfect and pure transverse plane or the horizontal plane. Now how will you describe this motion? So during internal rotation you will see that the glenoid fossa is moving anteriorly and medially. So during the internal rotation, okay, glenoid fossa move anteriorly and medially, while in external rotation it is moving posteriorly and laterally. Glenoid fossa is moving posteriorly and laterally. So the reference point is definitely the glenoid cavity, while in the sternoclavicular joint reference point was, tell me, reference point was the lateral end of clavicle. Okay, so it was the lateral end of clavicle. Here the reference point is glenoid fossa or the glenoid cavity. So internal rotation, it is moving anteriorly and medially. External rotation, it is moving posteriorly and laterally. And range of motion, it is around 30 degree, or you can write it as 20 to 30 degree. So this is whole about internal and external rotation. Now the next movement is anterior tipping and posterior tipping. It is like this: anterior tipping, posterior tipping. Let me make you understand from side. Anterior tipping, posterior tipping. Okay, anterior tipping and posterior tipping. So this is the movement which is occurring in flexion extension plane, and that plane is the medial plane or the sagittal plane. Also it is oblique. So axis will be frontal axis or the coronal axis. Also it is oblique. Very simple, very easy to understand. Now during anterior tipping, acromion is moving anteriorly. Okay, acromion is moving anteriorly, and the inferior angle of scapula is moving posteriorly. So motion in the anterior tipping, acromion process go anteriorly, while inferior angle of the scapula is moving posteriorly. While in the posterior tipping, the acromion process will move posteriorly and the inferior angle will move anteriorly. Very simple. During anterior tipping, acromion process is moving anteriorly and inferior angle is moving posteriorly. While posterior tipping, the acromion process is moving posteriorly and inferior angle is moving anteriorly. Very simple, very easy to understand. Range of motion is around 20 degree. Now another important thing regarding to these two motions. This resting position was also related to this fact that I am now explaining, is that these movements occur in such a way that they keep the scapula move over the thorax. So let me explain. So this one is thorax. During internal rotation it move like this, and during external rotation it move like this. Internal rotation, external rotation, anterior tipping, posterior tipping. So they keep the scapula with the thorax. Okay, so this is what I want to explain. Last movement is the upward rotation. I want the black marker. Upward rotation and the downward rotation. It is also very simple. Upward rotation, glenoid fossa move upward. Downward rotation, glenoid fossa move downward. Okay, so it is which plane? It is the abduction adduction plane, that is frontal plane or the coronal plane. Frontal plane or the coronal plane. Which one? Oblique one. Okay, plane is written downward, na? Plane is here. Okay, oblique frontal plane or coronal plane. Axis is oblique medial axis or the sagittal axis. Very simple. And how will you describe the motion? During the upward rotation, glenoid fossa is moving upward and inferior angle is moving laterally. While in the downward rotation, glenoid fossa move downward and inferior angle move medially. See, in the upward rotation, glenoid fossa move upward and inferior angle goes laterally. While in downward rotation, glenoid fossa move downward and inferior angle move medially. Okay, so during the upward rotation, glenoid fossa move upward. Okay, also the inferior angle move lateral. And in the downward rotation, the glenoid fossa move downward. Okay, move downward and the inferior angle move medially. Okay, inferior angle move medially. Okay, so it is this and this movement. Okay, so here the range of motion, upward rotation is around 30 degree and downward rotation is around 17 degree. Okay, so these range of motion are not much accurate. Okay, but according to some authors, this is the correct one or the most accurate range of motion measured till now. Okay, so this is about the acromioclavicular joint motion. Okay, let me explain you again. First is internal rotation and external rotation. In internal rotation, glenoid fossa move anteriorly. External rotation, glenoid fossa move posteriorly. Next one is anterior tipping. Acromion go anterior, inferior angle go posterior. Then posterior tipping, acromion process go posterior, inferior angle go anterior. Next is upward rotation. Glenoid fossa go upward, inferior angle go laterally. Downward rotation, inferior glenoid fossa moves downward and inferior angle moves medially. Okay, so planes I have explained. This one is pure plane. Okay, this one is pure, pure or the cardinal plane, but these are oblique axis and oblique planes, and the movement occur along with the thorax. That is also important. And the last part is the acromioclavicular joint stress. Yes, in comparison to sternoclavicular joint, this joint is like having more trauma, more injury, also have age related degenerative changes. So we can say injuries are very common, seen in the second and the third decades. Okay, also the surfaces were irregular, which lead to its predisposition toward injury and trauma. So it is very common to have a patient with acromioclavicular joint injury. So with this we are completing acromioclavicular joint. In our next lecture we will study about scapulothoracic joint. Till then you keep on studying. Thank you to one and all.